Let's discuss about the causes of edema. Edema will occur when there is an increase in the intravascular hydrostatic pressure and decrease into the plasma osmotic pressure. First one is a increased hydrostatic pressure. Hydrostatic pressure will increase whenever there is an obstruction of a venous outflow, which happen during the passive hyperemia or congestion. This venous obstruction is caused by the congestive heart failure. In animals, this cause of edema is less important than in humans. At the arterial end of the capillary, hydrostatic and osmotic pressure are 45 mm of mercury and 30 mm of mercury respectively. So in result, at the rate of 50 mm of mercury, the fluid flow from intravascular to the interstitial compartment, which is a normal thing, right? But at the venous end of the capillary, the osmotic pressure is 30 mm of mercury and hydrostatic pressure is 20 mm of mercury. So in the result, at the rate of 10 mm of mercury, the fluid return to the intravascular compartment from the interstitial compartment. So if we do the final net calculation, there would be 15 mm of mercury minus 10 mm of mercury gives the 5 mm of mercury. Therefore, at the rate of 5 mm of mercury, the fluid accumulate into the interstitial space and ultimately result into the edema. And this type of edema is mild in nature. Second cause is a reduced plasma osmotic pressure. This plasma osmotic pressure is created by the plasma protein, mainly the albumin. Suppose if there is an excessive loss of plasma protein or decrease into the synthesis of plasma protein, it results into the reduced plasma osmotic pressure. Let's understand it by the examples. At the arterial end of the capillary, the hydrostatic pressure and the osmotic pressure are 45 mm of mercury and 20 mm of mercury respectively. So in result, at the rate of 25 mm of mercury, the fluid flow into the interstitial space. For the venous end, osmotic pressure is 20 mm of mercury and hydrostatic pressure is 15 mm of mercury. So only at the rate of 5 mm of mercury, the fluid comes back to the intravascular compartment. So it leads to the final net calculation. There would be 25 mm of mercury minus 5 mm of mercury, which gives the 20 mm of mercury. Therefore, at the rate of 20 mm of mercury, the fluid accumulates into the interstitial space. That's why this type of edema is severe in nature.